Dr. Malkin, is dental phobia real? I know that some patients are really traumatized by prior dental visits. How do you deal with this?
I mean, dental phobia is very real. And as a practitioner, you have to be very empathetic to it because it might seem silly sometimes, because as a practitioner, you see a lot of patients and those procedures become kind of routine. But for some patients, it's extremely real. And you kind of have to understand first where it's coming from. Is it coming from a bad experience? Is it coming from the pain they experienced during the procedure? Was it that the dentist shamed them for something, which actually I find really unacceptable. And I hear that a lot, that the patients were shamed for their dental condition. As a practitioner, I think it's actually wrong in so many ways. Not only are you damaging your practice, but you creating a patient who's not even going to come back and seek treatment, which can even be life-threatening to a patient. So when they come in, or they're finally able to come in, obviously they're aware of their condition, and shaming them is the last thing that should be done. They actually are brave to come in, and we're here to help them. And that's what I always tell patients. Sometimes patients tell me, oh, you've never seen such a horrible situation in the mouth. And I say that I've seen a lot, and it doesn't matter. You're here, you made the first step, you came here, and it's now my job to help you. So in terms of dental anxiety, we have to figure out where it's coming from. So, and in the practice, we have different things from oral sedation to IV sedation that we can help patients with to be able to go through the procedure. But another thing that I think is really important is to transform this anxious patient into a patient who is able to come in and get their treatment done on a regular basis. Because it's not only about patient coming in, we fix their mouth, but now they have to take care of it. They have to come every 3, 4, 6 months to get a cleaning done, because otherwise whatever we've done is going to deteriorate. So it's not only getting through the treatment, sedating them and just getting things done, but also trying to change the mindset of the patient. Try to make them comfortable, figuring out where the fear came from, and create a more positive experience. So now the dental treatment is not something that they're fearful of and something they can undergo. So this way they can preserve what we created, like a healthy mouth that we created, so they don't have to end up in the same situation again.